everyone, welcome to a new video. Today we are going to discuss NEJM notable articles of 2024. This presentation is going to highlight the research published in New England Journal of Medicine in the year of 2024. Let's dive in and discuss the new articles. So first is live attenuated tetravalent butantan dengue vaccination in children and adults. A single dose of butantan dengue vaccine effectively prevented symptomatic Den V1 and V2 serotype infection in children and adults, regardless of their dengue serostatus, for up to 2 years. Regarding the vaccine effectiveness across different age groups and serostatus suggests a significant step toward dengue prevention. Further research will definitely be needed to continue evaluate its long-term effectiveness and impact on global public health. Coming to the next research, this is an interesting research on resmetirom. Resmetirom is an oral liver-directed thyroid hormone receptor beta selective agonist. So it is a phase 3 trial, randomized controlled trial of resmetirom in NASH, non-alcoholic steatohepatitis with liver fibrosis. Two doses of resmetirom, 80 mg and 100 mg, demonstrated superiority to placebo in achieving NAS resolution and improving liver fibrosis by at least one stage. This is an interesting study, and most of the studies are sponsored by the pharma companies themselves. I think in real world there will be much more studies needed to see how effective are the studies. So coming to the next, omalizumab, we know that it is a monoclonal anti-IgE antibody for the treatment of multiple food allergies. So this study showcases that in persons as young as 1 year of age with multiple food allergies, omalizumab treatment for 16 weeks was superior to placebo in increasing the reaction threshold for peanut and other common food allergens. This is also an interesting study. You should go back and study the whole full article if you are interested in reading about omalizumab. Coming to two important drugs of 2024, one should be semaglutide and the other one is terzapatide. So this study, which focuses on effects of semaglutide on chronic kidney disease in patients with type 2 diabetes mellitus. So semaglutide reduced the risk of clinically important kidney outcomes and death from cardiovascular causes in patients with type 2 diabetes and chronic kidney disease. There are many studies coming up with semaglutide and terzapatide. There are lots of articles also available over the internet. I think they are very interesting to study. Semaglutide, which is an GLP-1 receptor agonist, that is glucagon-like peptide receptor, I mean one receptor agonist, is interesting molecule for this year at least. Again, coming to terzapatide, as we have discussed, this is also an interesting molecule which is available in the market in the year of 2024, and there are huge studies which are going on the effectiveness of these molecules in weight loss. Also, there are many articles in the journal itself. So tirzapatide, a promising treatment for MASH, that is metabolic dysfunction associated steatohepatitis and liver fibrosis. This is a phase 2 trial involving participants with MASH and moderate or severe fibrosis treatment. With tirzapatide for 52 weeks was more effective than placebo with respect to resolution of MASH without worsening of fibrosis. These promising results warrant larger and longer trials to confirm the efficacy and safety of tirzapatide for treatment of MASH, offering hope for patients with this challenging liver disease. Again, coming to the group of drug tirzapatide, it is a long-acting agonist of both GIP and GLP-1 receptor agonist. GIP is glucose-dependent insulinotropic polypeptide 1, and also GLP, as we have discussed, glucagon-like peptide 1 receptor agonist. So that's about terzapatide. Coming to this is a very interesting study of all the slides. So lenacapavir, again a new drug for HIV. We have studied regarding protease. We have studied regarding the protease inhibitors, NNRTI, NRTI. This is a new group of drug again ending with pavir. So again, it's not a protease inhibitor. This drug is given as subcutaneous once every 26 weeks. It is a first in class. It is a multi-stage HIV-1 capsid inhibitor. So when this lenacapavir, there were no participant receiving twice yearly lenacapavir acquired HIV infection. HIV incidence with lenacapavir was significantly lower than background HIV incidence and HIV incidence with daily oral emtricitabine and tenofovir regimen. So you have to go back to the study and read more regarding lenacapavir to understand more about this molecule. This study provides crucial evidence for the effectiveness of lenacapavir as long as a long-acting agent for HIV prevention, potentially leading to new prevention strategies that are easier to manage and adhere to for individuals at risk. As it is given only twice yearly, it is a very important molecule. I think more studies are required regarding the side effect profile and how efficacious is the molecule. And yes, definitely a subcutaneous injection twice yearly is much more needed for retroviral disease positive patients. Again, one more interesting study regarding cancer cachexia, Poncigromab. It is a GDF15 receptor inhibitor. GDF is nothing but growth differentiation factor 15, which is a circulating cytokine, which is usually increased in patients with cancer, causing cachexia. So, among patients with cancer cachexia and elevated GDF15 levels, that is growth differentiation factor 15 levels, the inhibition of GDF15 with Poncigromab resulted in increased weight gain and overall activity level and reduced cachexia symptoms, findings that are confirmed the role of GDF15 as a driver of cachexia. Again, this molecule Poncigromab is an inhibitor of GDF15. As again, interesting study. You should go back and study the whole article if you are interested in this. Coming to the CRISPR-based therapy for hereditary angioedema, again CRISPR-based technology is coming up huge in the field of autoimmune diseases, I guess. So this molecule NTLA 2002 is an in vivo gene edited therapy that is based on CRISPR for treating hereditary angioedema. CRISPR, we know that the full form stands as clustered regularly interspaced short palindromic repeats associated protein 9. This is Cas9. So, administered in a single dose of 25 mg or 50 mg reduced angioedema attacks and led to robust and sustained reduction in total plasma kallikrein levels in patients with hereditary angioedema. These results support continued investigation in a larger phase 3 trial. I think it is much more needed further assessing the molecule, and much more trials are needed for further assessing the usage of the molecule Poncigromab. Again, an interesting study again. So, triple negative breast cancers, that are the cancers that don't express estrogen or progesterone receptors and also lack overexpression of HER2. So, overall survival with pembrolizumab in early stage triple negative breast cancer, neoadjuvant pembrolizumab plus chemotherapy followed by adjuvant pembrolizumab resulted in a significant improvement as compared with neoadjuvant chemotherapy alone in overall survival among patients with early stage triple negative breast cancer. If you want to know regarding pembrolizumab, it is a PD-1 inhibitor, that is program death 1 inhibitor. You should go back to the study and look into it. Coming to improving outcomes in advanced Hodgkin's lymphoma and nivolumab role, again nivolumab again PD-1 receptor inhibitor. So nivolumab combined with doxorubicin, vinblastine, and carbazine resulted in longer progression-free survival and a better side effect profile compared to brentuximab with the same chemotherapy regimen in patients with advanced stage Hodgkin's lymphoma. My pronunciation might be wrong, but the nivolumab is a very good molecule for the advanced Hodgkin's lymphoma, that is stage 2 and stage 3. This is an interesting article. You should go back and really understand more about nivolumab, the monoclonal antibody. Coming to my last slide, Fendrinon. Fendrinon is again a very good molecule, not only for heart failure, also for CKD patients in reducing the proteinuria and the progression of chronic kidney disease. I think Fendrinon is also an important molecule which is coming up huge in terms of research. So, Fendrinon in heart failure with mildly reduced or preserved ejection fraction. In patients with heart failure and mildly reduced or preserved ejection fraction, Fendrinon resulted in significantly lower rate of a composite of total worsening heart failure events and death from cardiovascular causes than placebo. I think this is the summary of all the articles which are in that book, notifiable articles. You should go back to that book, which is available as free in the NEJM website, and read more about the notifiable articles completely. Thank you so much. I hope you enjoyed this video. Please like, share, and subscribe.